Hi, thank you for tuning in to Dr. Bowman. I am Dr. LaTanya Bowman, WDRBmedia, the voice of your community. Today's show is Discover the Best You. Thanks for coming in and checking us out today. We come on the show every Thursday at 2 p.m. Again, my name is Dr. LaTanya Bowman. I'm a chiropractic physician and owner of Discovery Chiropractic and Wellness Center. You can find me at discoverychirowellness.com. That's Discovery, CHIRO, wellness.com. This is our third show, and with the show, we talk about different health topics and health and wellness and learning how to be the best you for 2020. The past two shows, you did hear about how does pharmacy affiliate it with wellness care. So you listened to Dr. Martez Prince. Today we have another special guest, Dr.Tiky Swain.
Hi, how are you?
Doing good. Dr. Swain, she's actually my dentist. She's one of the top dentists here in the city of Charlotte. You tell how you became a dentist and your new location and your present location.
Oh, wow. Okay. Many moons ago. I started out as a sports and exercise science major at University of North Carolina, Chapel Hill. After a couple of rounds of working with athletes and stuff, I realized it's just really what I wanted to do. Mm-hmm. One of my mentors, Dr. Robert Selden, who's an orthodontist here in Charlotte, North Carolina, actually had me come over to the dental school to do a research project with them. And it was just like it was meant to be. I fell in love. And it was dentistry ever since then. So went to UNC Chapel Hill for undergrad and for dental school. And I've been practicing for over 13 years now.
Oh, wow. That's a long time like me.
I know. It doesn't feel like it. It goes fast. You said, time flies when you're having fun. So we love what we do at Dasling Dentistry. We're located in a university area, Charlotte, North Carolina, where we practice complete health dentistry.
Nice. Mm-hmm. So you're a family practice.
Yes, we are general dentistry, and what that basically means is that we do everything. So we're not specializing in anything, but we do have referral basis for things. But for most dental procedures, we do perform them.
Mm-hmm. Okay. So today's topic is actually going to be about preventative care. As you know, my major was in sports medicine too, and I just navigated that into chiropractic. But even with chiropractors, we talk about preventative care.
Absolutely.
And one of the things that people are very well known about is your teeth. You guys, back in the 80s, I assume a lot of people remember this, you all used to come into the elementary schools and teach people how to brush their teeth and floss, and taught people that, go to your dentist every 6 months. Mm-hmm. That's one of the things that chiropractors, that we're needing to start to do the same thing.
Right.
Just because when it comes to disc degeneration, it's the same thing as degeneration of your teeth, is decay. And when it comes to teeth are the exposing of your bone,
right,
and your gums are muscle. So that's like one of the main exposure areas in your whole body.
Right.
Yeah. So talk to us a little bit about preventative care and why it's so important.
Well, of course, we want to be on the side of, we don't want to watch for the bad thing to happen. We want to be on the side of prevention, not reaction. And so the big thing that we teach our patients is that home care is so important because, our visits are 2 times a year. And we are there to check in for maintenance and make sure patients are doing what they're supposed to. Mm-hmm. But it's so important that patients are brushing 2 times a day and that they're flossing. Flossing, for some reason, is one of the veins of existence amongst my patients. It's like I have to, hammer it home all the time. I tell patients brushing without flossing is like putting your hand in a vat of mud. Mm-hmm. And then closing your hands up and then washing your hands like this. Like you're getting all the exterior dirt off, but all in between is where everything is still. And so that's the problem with when you don't floss, is that you're leaving all the bacteria in your mouth.
Right.
When you don't floss. And it recurs every day. So even though you brush the bacteria that causes the decay or infection and gum disease, reoccurs in your mouth every day, within hours actually after brushing. So that's why it's so important to do it daily, to make sure that you're not in my chair needing things like, or, suffering from things like gum disease or periodontal disease or tooth decay.
Right.
I always say, I love to take your money, but I prefer not to.
Right.
So prevention is really key. I mean, and our goal is that people keep their teeth for a lifetime. Also, what preventive care does is that infection in your mouth has also shown a direct correlation to cardiovascular disease. So the plaque is the precursor to periodontal disease. Periodontal disease has been linked to cardiovascular disease. So a lot of my patients, I talk to them about how important it is to get that bacteria out there because it can be found also in the heart. So patients who are suffering from things like high blood pressure, heart disease, all those things, your mouth plays a role in making those conditions worse.
Right. And with that, what is the age when you should be starting to go see the dentist?
Typically, they say when you get your first tooth. So that's what pediatric dentists are. I'm a general dentist, though I love kids. I prefer they see when they get their first tooth to see the pediatric dentist. And then from there, of course, they progress into adult dentistry. However, I tell moms that when they have kids to come in, that make sure they're brushing, taking your cloth, wiping the mouth out, that they're taking care of that first tooth. I think that behavior-wise, most kids are able to sit in a chair around 3 years old to be able to be examined and make sure they're taking care of teeth, and parents are taking care of their teeth, and they are creating an experience that they know dental care is important and that is needed and necessary. Right.
So you say around 3 years old is about the best age for a child to start getting seen by the dentist.
Absolutely.
All right, that's good to know.
Absolutely.
Because like even with chiropractic, we can start with babies when they're first born.
Yeah.
So, we always tell the mothers to come see us at the very beginning, not why they are as they're going through their growth spurts. A lot of people come see us as adults, but to prevent disc degeneration, it's best to go when you are a baby, a child. You can avoid all of that.
Well, that's the lesson I've learned from you as you are my chiropractor. That not wait for the bad thing to happen. And I think that what I find in dentistry also as a patient of yours is knowing that had I been coming on doing based on what I do and how strenuous it is and how taxing it is on my body, how important it is to come in for maintenance visits to make sure I'm adjusted and that, everything is in alignment. That is now prevention for me and not waiting for my shoulder to lock up or my back to be in pain. But those things are, in line with what I tell my patients. You don't want to wait for the bad thing to happen because when that's when you're hearing emergencies and you're suffering from pain or tooth loss. Right.
And the thing is about teeth affiliated with that, children, you have your, I guess what you want to call the
baby teeth.
When they come out, those permanent teeth, they stay and they're for life.
Yes.
So when you see adults like in their 60s, where the teeth start coming out, just fall out, 60s or 70s, where does that come from, or how does that occur?
That's a great question. That is what we call chronic adult periodontitis. So that's the condition of periodontal disease where it's gotten so progressive and so advanced that it's caused so much bone loss that the teeth have no support. So the teeth become mobile, and then unfortunately we can't get bone back. So the teeth have to be extracted or they come out sometimes on their own. And then that people are forced to have prosthetics such as dentures or partials. And something more expensive is that they would then have to do something like implants. And I tell people all the time, it's so important to keep your teeth because it's so expensive to replace teeth.
It is.
And tooth loss also can lead to a lot of different situations in regards to not over just financial, but about also physically how you look. You know, when you lose teeth, your face sinks in. You lose the bone support, so you look older. Also, when you have less teeth, your food options change. You can't choose a lot of the health fruit that's rich in nutrients and things like your vegetables and crunchy things. You're more subjected to carb-rich things, which then increases your risk for diabetes and heart disease. So your teeth play a very important role in your life.
It does. It's like I tell a lot of people, I guess when it comes to the teeth, people are more known, are a little bit more knowledgeable about that than spinal care.
Right.
And so we use an example of the teeth to show or to explain the degeneration of the spine. And a lot of people think, just like when you get a cavity, oh, it's no big deal.
Right.
Not thinking that you have to scrape it out and fill it in. And with the spine, you can't do that.
Right.
You know, with the spine, what you see is what you get, unless somebody physically cuts you open. And the only thing they do with that is take the disc out and clean it and fuse it back together.
Wow.
So it's not like you're able to put something in there to fill it in.
Right.
And so it's very important when it comes to health and wellness that you take care of your body.
Absolutely.
And the purpose of it is to make sure that you see your physicians in order to prevent problems for the future. That's why you see them, to prevent issues.
Yeah, absolutely.
Yeah.
I think that's super important. And that goes back to what we do in our office, which is complete health dentistry. We talk about how the mouth relates to the body and how the body relates to the mouth. So again, things like that in regards to it being full, a cyclic thing in regards to, you know, if you don't take care of your mouth, these things can happen. If you don't take care of your spine, like, you know, all those things all play a role in how your body functions. And so, you know, prevention is very key in all times. So, and I think that part of it is knowing, you know, like a lot of things that you taught me in regards to chiropractic care, I didn't know. And that ignorance for me was bliss up until the point when I needed your help. So we do our job to over-educate patients. And give them information that we think that they may not need, just because there's a lot of missing gaps there in healthcare. So we try to, you know, close those gaps as much as we can by, you know, talking all the time, educating, giving tools, doing things like this, and creating platforms for patients to be able to check in and ask the questions.
And with that, when a child starts seeing you as the family dentist, what age does that need to start? Like as soon as all the baby teeth are out, or?
No, we see patients, like I said, we see them from 3 and up. Again, when families come in, mom and dad, they bring their kids in, and we're more than happy to see kids. I think a lot of times people think baby teeth are, oh, we're going to lose those teeth and it's, you know, whatever. However, the baby teeth hold the position for the adult teeth. So if you lose a tooth prematurely, it can cause the adult tooth to grow in incorrectly or not at all, or delay the growth of that tooth. So it helps to facilitate the growth of the adult tooth. The baby tooth does. And then also, we hate to see babies hurting, and, you know, because, you know, they get cavities too, and they're in a lot of pain, and they can't communicate as well as we can. So a lot of times we see babies come in with facial swelling from infection, because, you know, we as parents, we're not perfect. You know, we want to give our kids the things that they want. If they want the sweets and the candies, and we educate parents on, you know, how juices affect them, have a lot of acid and sugar, how having sipping on bottles all night is really bad, because it just pulls sugar in the mouth all day long.
And also, if it pulls the 2 teeth forward, is that correct?
That's from thumb sucking or pacify sucking. Yeah, so we and that's a hard habit, because my daughter sucks her thumb. So I just like that so much. But we talk about how that can facilitate the position of teeth and cause people to have open bites and stuff like that. So so a lot of things that we can educate even from that point of view, how to have great home care, because it's showing up more and more. I'm seeing a lot of young kids come in with mouthful of cavities.
And I've noticed that too. When the patients bring their kids, I see that, you know, you just glance and you look around, see what's going on as you're examining them. And where do you think, I remember this one lady told me that her daughter had, you can see she had a lot of fillings, and these were not even adult teeth, these were baby teeth. And she was saying that it was because the milk was too sweet or something. And it didn't make sense, but I was just like, oh, okay. So
well, that's the prolonged, what we call baby bottle caries. So sometimes, again, we're parents, not perfect. You know, when you want to soothe your child, you'll say, here's a bottle. And sometimes you do that at nighttime. And and so that's, 8 to 10 hours
of drinking.
So that everything has sugar in it, and milk does too. Not as acidic as your sodas, but it still has sugar in it. And so the bacteria, like I said, is naturally formed in all our mouths.
Okay.
And so that bacteria uses that sugar, and that prolonged period of sugar exposure creates the decay in the patient's mouth.
Right.
And so a lot of times that's what happens. And I think a lot of our pediatricians have participated in helping to talk to parents about not letting the baby sleep with a bottle night, give it water instead, and not have the bottle in there all the time. So.
I learned something new right there. That is great.
Yeah.
Well, again, thank you for being on the show.
Absolutely.
And tell them where you are.
Yes, we are located at University 8420 University Executive Park Drive, Suite 805, Charlotte, North Carolina. And our office is Dasling Dentistry. That's DASLING Dentistry. And our website is www.daslingdentistry.com. That's DASLING. And you can find us there with that name also for our Facebook and Instagram and Twitter. And also we are opening our second location to service our people in South Charlotte or South Carolina, and it's Dobie's Bridge. It is to be announced. We have a location, but we're working on our social media and our outlets to have people reach out to us. So coming soon, we are expected to open doors around March, April. So
that's around the corner.
That's around the corner, and we're excited about that.
Yeah.
And we have an amazing team, and we love our patients, we love our community, and we love doing things like this to help give back, because it's so important that we do our part outside our four walls.
Absolutely. Well, again, thank you for talking to us today. This is, again, Dr. LaTanya Bowman, a.k.a. Doc Bowman. You can find me at Discovery Chiropractic and Wellness Center. Our office is Discovery, CHIRO Wellness.com. That's Discovery, CHIRO Wellness.com. And our office number is 704-946-2054. And you can find me on Facebook at dr.lbowman, and also Instagram at dr.lbowman. So thanks again. Tune in soon.